Opaque or white hemithorax on X-ray. Hey everyone, welcome to Red Mamples, where radiology meets storytelling. Today we're going to talk about opaque hemithorax. In this video, we break down complex concepts into simple digestible pieces to help you learn and retain information quickly. So what is an opaque hemithorax? Simply, it's a lung that looks like it has a white density similar to bone. The lung should be black, have a sponge-like texture which allows air to pass through easily. When we see an opaque or white hemithorax on chest X-ray, it means there's something in the thoracic cavity or in the lung tissue taking up space and shouldn't be there. Ask yourself these two questions. 1. What is the volume? And 2. Where is the mediastinum? Let's work through some cases together. Case 1. Reduced volume. Here we see one lung has collapsed and the trachea is shifted towards the area of the collapse. On X-ray, lung collapse appears as a white area because there is no longer an air-filled lung to create an image. The trachea, however, will always be a black tube area in the center of mediastinum. In this case, the lung has collapsed and the trachea has shifted towards the opacity due to decrease the lung volume. Case 2. Increased volume. Here we see the entire thoracic cavity is filled with a fluid-like density, pushing the mediastinum to the opposite side. This finding is concerning for pleural effusion or empyema. Pleural effusion is a collection of fluid in the pleural space. When the fluid becomes infected, it's called empyema. Regardless of whether the fluid is infected or not, it's important to treat because a large enough collection can cause a lung to collapse. Case 3. Normal volume. Here we see full lung opacity without any visible tracheal deviation. The lung is completely filled with a dense material, but there's no shift of the trachea. When we see an opaque lung without any other clues, it helps us think of conditions that affect the lung tissue, such as pneumonia or a mass. So to summarize, if the lung is completely opaque, ask yourself these two questions. Is the lung volume reduced, increased, or normal? And where is the mediastinum? Is it shifted or not? One last thing, when evaluating a chest X-ray, don't forget the clinical context. Look at the patient as a whole. Are there any other things on the X-ray or in the history and physical that can help point you in the right direction? For example, look at the trachea. Does it appear to be shifted? Look at the costal spaces. Are they normal or wide? Is the diaphragm pushed up or down? All of these things matter. We hope you enjoyed this video. If you did, make sure to let us know by hitting that like button.